Okay, that'd be great, Dr. Garvin. So there's nothing really for me to worry about as far as another surgery or
No.
my spine?
No, you're going to get over this. It may take some time.
We've been doing telehealth here at Nebraska Medicine for many years.
Is right at where we have it set.
We implemented a few different types of technology. One of them that has been really successful lately has been the implementation of home telemedicine, where we're able to do video visits into a patient home.
Any questions or concerns, anything? We need any refills on your medicines?
No, I'm fine there too.
Telehealth is a great option for many of my patients because they have chronic conditions. I know them well, and so I'm able to see and interact with them.
So you still have a pretty significant amount of swelling, don't you? Just throughout the knee there.
It's always worse by the end of the day, but yes.
We have used telemedicine orthopedics more for people who are located in areas outside the metro. I think it makes a big difference for the patients just to be evaluated, even though this is a video evaluation instead of in-person evaluation. I think it's reassuring. It maintains a connection to the patients, which is so important as well.
I think one of the things that is a barrier for our patients is that they are at dramatically increased risk for a bad outcome if they were to be infected with the coronavirus. For our patients, being able to continue to get the care that they need while not being out in the community and exposed to the potential risk of having coronavirus exposure is a huge asset.
So we could set that up as well.
I actually think I would prefer that.
Our providers have been phenomenal in embracing this, and I think that's one of the amazing things at Nebraska Medicine is our providers are huge advocates for however they can take care of patients. Care does still go on and day-to-day goes on, so this allows us to see our patients in a safe way for both our patients and for our providers.
Many of them have a lot of concerns and anxiety about the coronavirus. Many of them see things on the internet that may or may not be true. And so being able to reach and discuss with them their interpretations about the coronavirus become important.
We're looking continuously on improving. So we started in the ambulatory, we're looking at inpatient applications, how to still keep patients and families connected when they're in that inpatient environment, but also looking at additional services like physical therapy and registered dietitian and all the great education components that would come with a normal course of care.
Once the coronavirus pandemic clears, I think we will continue to use telemedicine. It is good for many of my patients who have things like pacemakers where we can do downloads and remote access.
I think it's probably here to stay. It won't substitute for the evaluation in person, but I think it's a nice complement.
It will be a benefit. We see our patients very frequently after their transplants, and it will be a benefit for those people who live really far away to do some telehealth and some in-person appointments.
And what do you think about all of this telemedicine stuff? Does this work for you?
Oh, absolutely. I thank you guys at the Med Center and all the doctors and so forth for what they're doing during this trying time and putting yourselves on the front line. That's commendable, and obviously it's probably the safest way to communicate.
This is the way to go right now.
Yeah.
I appreciate that you set this up so that we have an opportunity to find out what's going on. This is wonderful.